this is where we were. We're looking at the lymphadenopathy and SLE. Only thing I would like to mention is the hemotoxin bodies, which are specific for the slide. You see them, you know what it is, and there are several. And it's basophilic infiltrate, so you would think that it's bacterial infection or something, but or not. I don't know why they would say that. Oh yeah, I'm sorry. I mean, like the basophilic foci, like they look like there's a bacterial infection, but there is none. Of course. Okay. Next slide is Gaucher's disease. This is the way it looks. If you want to remember Gaucher as gay, so you have the balls here. Whatever works. Okay, so this is a pass reaction, it says in the book. I don't know if that's true. So, there's something wrong with the menus here. So you see, you're supposed to see enlarged pass stain macrophages. Sorry for the mess. Had some issues loading, so I tried loading it again. It worked this time. At least you had a lot of time looking at it. As did I. Okay. So just the pass positive macrophages, and there are cortical areas that contain secondary lymphatic follicles, which we are in the cortex, and these are the follicles we're talking about. And yeah, you're supposed to see something called Gaucher cells or something, and I'm guessing that's the macrophages with the specific stain. It's not marked in the book or anything, or so I don't want to take a chance, but if somebody forced me, I would say maybe these here. This, and this, and this would be the Gaucher cells with the positive staining. Okay. Next slide is gouty typhus. This is the way it looks. Okay. Got some time to look at it. What is it? Gouty typhus. So we did 36 slides, that's not bad. Okay. So I'm expecting to see some crystals or whatever here. Looks like, so yeah, so if you see the crystals are acting like foreign bodies. So, so the uric acid crystals themselves are like, they are dissolved in the paraffin embedding or during fixation. But this basophilic area here shows like if you look at it, there's this imprinting on it that is kind of the mark. If you see, if the crystals, the mark the crystals like left there. So you see here is very needly, like it's clearly that something was there, is visible. This is the gouty typhus. Visible in patients with gout. Here you go. You see some needle-like projections. Of course, this always sounds better in books. Reality is a bit harder to see sometimes. But this is what you see. 5 minutes now. to move faster. Okay. We did that one. Number 37. Signet cell carcinoma of the stomach with the pus stain. This is the way it looks. Okay, let's go in. So there are no markings, nothing. So for this slide I don't have much to say or anything. Go in and see if we can see any signet cells. I guess these are the signet cells. This area, like mucinous infiltrate of some kind. Here. And this is why we use the pus. So these are the signet cells. Actually, they look, I don't know, I think I would remember that. Okay. And this was the slide. Signet cell carcinoma of the stomach with pus stain. Remember that. Now we have Krukenberg something. Metastatic tumor of the ovary. The Krukenberg tumor. This is the way it looks. There's this little thing here. 3 minutes remaining. Okay. So let's go in to the stroma. Sorry, I'm going a little bit slow now. I'm just tired. So the surface is supposed to be covered by germinal cell epithelium. So let's move there and see that. It's supposed to be here. Here, yeah. Yeah, this is it. This is probably what we can see here. It's easy to see. And then if you go, you have these spindle cells here. And you will have the small fascicles that they make up here, like this, or this kinda, and here, and here, and here. Okay, that's it. 1 minute and 40 seconds. Let's see if we can do one more. Condyloma. Yeah, I think we can do that. Is it? Condyloma is the name. I think you should just remember this. If you did the autopsy, you should remember. Yeah, it's very typical, this architecture. I don't know, mucosa of something or something. Here. That's it. This is condyloma. This one you should not memorize this slide because obviously you should remember. I mean, you will recognize this, no problem. Okay, I think I will end it at here and go start with 40 on the next one.